Which of the following pharmacokinetic parameters is typically decreased in elderly patients? A. Volume of distribution. B. Half-life. C. Clearance. D. Bioavailability. The correct answer is C. Clearance is typically decreased in elderly patients due to reduced renal function. How can decreased liver function in elderly patients affect drug pharmacokinetics? A. Decreased metabolism. B. Increased excretion. C. Increased distribution. D. Decreased absorption. The correct answer is A. Decreased liver function can lead to a decrease in drug metabolism, affecting drug pharmacokinetics. Which of the following is a common consequence of decreased kidney function in older patients, affecting how their bodies process drugs? A. Increased drug metabolism. B. Decreased drug clearance. C. Decreased drug absorption. D. Increased drug distribution. The correct answer is B. Decreased renal function can lead to decreased drug clearance, affecting drug pharmacokinetics. Why is it important to consider age-related changes in pharmacokinetics when prescribing medications for elderly patients? A. To increase drug efficacy. B. To minimize adverse effects. C. To reduce drug costs. D. To simplify dosing schedules. The correct answer is B. Considering age-related changes in pharmacokinetics helps minimize adverse effects in elderly patients. Which of the following factors can contribute to altered drug absorption in elderly patients? A. Increased gastric pH. B. Decreased gastrointestinal motility. C. Enhanced blood-brain barrier penetration. D. Increased hepatic blood flow. The correct answer is B. Decreased gastrointestinal motility can alter drug absorption in elderly patients. How can polypharmacy impact drug pharmacokinetics in elderly patients? A. Increased drug metabolism. B. Decreased drug interactions. C. Alter drug absorption. D. Increase drug clearance. The correct answer is C. Polypharmacy can alter drug absorption due to potential drug-drug interactions in elderly patients. Which of the following organs is commonly affected by age-related changes impacting drug metabolism in elderly patients? A. Heart. B. Kidney. C. Liver. D. Lungs. The correct answer is C. The liver is commonly affected by age-related changes impacting drug metabolism in elderly patients. How can changes in body composition in elderly patients affect drug distribution? A. Increase in total body water. B. Decrease in muscle mass. C. Increase in plasma protein binding. D. Decrease in body fat percentage. The correct answer is C. Changes in plasma protein binding due to altered body composition can affect drug distribution in elderly patients. What is the typical effect of reduced kidney function on how the body gets rid of drugs in older adults? A. Increased clearance. B. Decreased clearance. C. No effect on clearance. D. Variable effect on clearance. The correct answer is B. Reduced renal function typically leads to decreased drug clearance in elderly patients. Which of the following pharmacokinetic parameters is typically increased in elderly patients? A. Renal clearance. B. Volume of distribution. C. Half-life. D. Metabolism rate. The correct answer is B. As people age, the volume of distribution of drugs tends to increase due to changes in body composition and decreased lean body mass. What is a potential consequence of low albumin levels in older patients, affecting how their bodies process drugs? A. Increased free drug concentration. B. Decreased drug half-life. C. Enhanced drug metabolism. D. Faster drug elimination. The correct answer is A. Reduced albumin levels can increase the concentration of free, unbound drug in the bloodstream. This can lead to increased drug effects and toxicity. Why is it important to monitor drug concentrations when dosing medications in elderly patients with altered pharmacokinetics? A. To adjust the dosing regimen for maximum drug efficacy. B. To avoid adverse drug reactions. C. To account for changes in renal function. D. To prevent drug-drug interactions. The correct answer is B. Monitoring drug concentrations is crucial in elderly patients to avoid adverse drug reactions due to altered pharmacokinetics. In elderly patients, how does decreased cardiac output influence drug distribution? A. Decreased distribution of drugs to target tissues. B. Increased drug distribution to fat stores. C. Enhanced drug clearance by the kidneys. D. Reduced drug metabolism in the liver. The correct answer is A. Reduced cardiac output can limit the distribution of drugs to target tissues in elderly patients, potentially affecting therapeutic outcomes. Which organ is primarily responsible for age-related changes in drug metabolism, leading to altered pharmacokinetics in elderly patients? A. Liver. B. Kidneys. C. Lungs. D. Brain. The correct answer is A. Age-related changes in liver function can significantly impact drug metabolism and clearance, affecting the pharmacokinetics of drugs in elderly patients. How can changes in body fat percentage in older adults affect how their bodies process medication? A. Increased drug clearance. B. Enhanced distribution of fat-soluble drugs. C. Delayed drug metabolism. D. Reduced volume of distribution. The correct answer is B. Changes in adipose tissue composition in elderly patients can lead to enhanced distribution of lipophilic drugs, affecting their pharmacokinetics and potential effects. What is the usual consequence of decreased kidney function on drug clearance in elderly patients? A. Increased renal excretion of drugs. B. Decreased drug half-life. C. Delayed drug absorption. D. Reduced drug metabolism rate. The correct answer is B. Decreased renal function can result in reduced clearance of drugs from the body, leading to prolonged drug half-life in elderly patients. Which of the following pharmacokinetic parameters is typically increased in elderly patients? A. Renal clearance. B. Hepatic clearance. C. Volume of distribution. D. Absorption rate. The correct answer is C. Less than break time equals 1s greater than. In elderly patients, the volume of distribution is typically increased due to changes in body composition and decreased protein binding. How can changes in body fat percentage in older patients affect how drugs spread throughout the body? A. Increased drug distribution volume. B. Decreased drug distribution volume. C. Increased drug breakdown. D. Decreased drug removal. The correct answer is A. An increase in adipose tissue percentage in elderly patients can lead to an increased volume of distribution for lipophilic drugs. What is a potential consequence of low albumin levels in older patients' drug absorption and distribution? A. Increased drug metabolism. B. Decreased drug binding. C. Increased drug absorption. D. Decreased drug clearance. The correct answer is B. Reduced albumin levels in elderly patients can result in decreased drug binding, leading to higher free drug levels and potentially increased pharmacological effects. Why is monitoring drug levels important when giving medicine to older patients whose bodies process drugs differently? A. To lower healthcare costs. B. To prevent drug interactions. C. To avoid side effects. D. To improve patient compliance. The correct answer is C. Monitoring drug concentrations in elderly patients with altered pharmacokinetics is crucial to avoid adverse effects related to suboptimal dosing. In elderly patients, how does decreased cardiac output affect drug distribution? A. Increased tissue perfusion. B. Decreased tissue perfusion. C. Increased drug metabolism. D. Decreased drug absorption. The correct answer is B. Decreased cardiac output in elderly patients can lead to reduced tissue perfusion, affecting drug distribution throughout the body. Which organ is mainly responsible for how our bodies process drugs differently as we age, affecting how medicine works in older people? A. Liver. B. Kidneys. C. Heart. D. Lungs. The correct answer is A. The liver is primarily responsible for drug metabolism. Age-related changes in liver function can significantly impact drug pharmacokinetics in elderly patients. How can drug interactions affect how the body processes medications in older adults taking many drugs? A. Decrease therapeutic effects. B. Increase drug clearance. C. Increase adverse effects. D. Decrease absorption rate. The correct answer is C. Drug-drug interactions in elderly patients can lead to increased adverse effects due to altered drug pharmacokinetics. In elderly patients, which of the following factors can affect drug distribution? A. Hepatic blood flow. B. Renal function. C. Cardiac output. D. Lung capacity. The correct answer is C. Cardiac output, which can be decreased in elderly patients, plays a crucial role in drug distribution throughout the body. How can changes in gastrointestinal motility impact drug absorption in elderly patients? A. Increase drug metabolism. B. Decrease drug binding. C. Increase drug absorption rate. D. Decrease drug clearance. The correct answer is D. Changes in gastrointestinal motility in elderly patients can affect drug absorption by altering the rate at which drugs are cleared from the body. What is the typical effect of reduced kidney function on how the body gets rid of drugs in older adults? A. Increased clearance. B. Decreased clearance. C. No effect on clearance. D. Altered distribution. The correct answer is B. Reduced renal function in elderly patients typically leads to decreased drug clearance, resulting in prolonged drug exposure and potential toxicity. How does decreased kidney function affect how the body gets rid of drugs in older adults? A. Decreased clearance. B. Increased clearance. C. No effect on clearance. D. Variable effect on clearance. The correct answer is A. Decreased renal function leads to decreased drug clearance in elderly patients. This is due to reduced kidney function, resulting in decreased drug elimination. What is a common consequence of age-related changes in drug metabolism in elderly patients? A. Increased drug metabolism. B. Decreased drug metabolism. C. Unchanged drug metabolism. D. Inhibited drug metabolism. The correct answer is B. Age-related changes often lead to slower drug metabolism in older adults, affecting how quickly drugs are processed and leave the body. How can changes in protein binding affect how drugs spread throughout the body in older adults? A. Increase drug distribution. B. Decrease drug distribution. C. No impact on drug distribution. D. Change drug absorption. The correct answer is B. Changes in protein binding can affect drug distribution in elderly patients. This happens by altering the amount of free drug available. This can lead to increased drug potency. Why is monitoring drug concentrations crucial when dosing medications in elderly patients with altered pharmacokinetics? A. To reduce side effects. B. To avoid drug interactions. C. To maintain optimal drug levels. D. To improve drug absorption. The correct answer is C. Monitoring drug concentrations helps ensure medications are at optimal levels for efficacy and safety in elderly patients with altered pharmacokinetics due to age-related changes. How does changing blood flow to different organs affect how drugs are distributed in older adults? A. Increases drug distribution. B. Decreases drug distribution. C. No effect on drug distribution. D. Alters drug absorption. The correct answer is B. Changes in blood flow to organs can impact drug distribution in elderly patients. This affects how quickly drugs reach different tissues, potentially leading to altered drug concentrations in various organs. How do age-related changes in liver enzyme activity affect drug metabolism in older adults? A. Increase drug metabolism. B. Decrease drug metabolism. C. No impact on drug metabolism. D. Enhance drug absorption. The correct answer is B. Age-related changes in liver enzyme activity can decrease drug metabolism in older patients, influencing how their bodies break down and clear drugs. Why can drug-drug interactions significantly impact the pharmacokinetics of elderly patients on multiple medications? A. Enhance drug metabolism. B. Inhibit drug absorption. C. Alter drug distribution. D. Affect drug metabolism. The correct answer is D. Drug-drug interactions can affect drug metabolism in elderly patients taking multiple medications, leading to potential changes in how drugs are processed and eliminated from the body. How can age-related changes in renal blood flow influence drug clearance in elderly patients? A. Increase drug clearance. B. Decrease drug clearance. C. No effect on drug clearance. D. Accelerate drug absorption. The correct answer is B. Changes in renal blood flow due to aging can decrease drug clearance in older adults, impacting how quickly drugs leave the body. What is the typical effect of decreased cardiac output on drug distribution in elderly patients? A. Enhanced drug distribution. B. Impaired drug distribution. C. Unchanged drug distribution. D. Promote drug absorption. The correct answer is B. Decreased cardiac output in elderly patients can impair drug distribution. This reduction in circulation slows how quickly drugs move throughout the body, potentially leading to altered drug concentrations in different tissues. What is the typical effect of decreased cardiac output on drug distribution in elderly patients? A. Increased distribution to tissues. B. Decreased distribution to tissues. C. Increased metabolism of drugs. D. Decreased metabolism of drugs. The correct answer is A. Decreased cardiac output can lead to decreased tissue perfusion, resulting in increased drug distribution to tissues. How can age-related changes in liver enzyme activity affect drug metabolism in older adults? A. Increased drug metabolism. B. Decreased drug metabolism. C. No effect on drug metabolism. D. Increased drug excretion. The correct answer is B. Age-related changes in hepatic enzyme activity can lead to decreased drug metabolism, resulting in slower drug elimination. Why can drug-drug interactions significantly impact the pharmacokinetics of elderly patients on multiple medications? A. Elderly patients have higher drug tolerance. B. Elderly patients have faster drug metabolism. C. Increased risk of adverse effects. D. decreased risk of drug interactions. The correct answer is C. Elderly patients taking multiple medications are at increased risk of drug-drug interactions. This can lead to altered pharmacokinetics and potentially cause serious adverse effects. How does changing blood flow to different organs affect drug distribution in older adults? A. No effect on drug distribution. B. Increased drug distribution to organs. C. Decreased drug distribution to organs. D. Increased drug absorption. The correct answer is B. Changes in blood flow to organs can influence drug distribution. Increased blood flow leads to increased drug distribution to those organs. What is a potential consequence of age-related changes in gut movement on how well elderly patients absorb drugs? A. Increased drug absorption rate. B. Decreased drug absorption rate. C. No effect on drug absorption. D. Increased drug metabolism. The correct answer is B. Age-related changes in gastrointestinal motility can result in decreased drug absorption rates, potentially affecting the efficacy of medications in elderly patients. How do age-related changes in renal blood flow influence drug clearance in elderly patients? A. Increased renal drug clearance. B. Decreased renal drug clearance. C. No effect on renal drug clearance. D. Increased drug metabolism. The correct answer is B. Age-related changes in renal blood flow can lead to decreased renal drug clearance, affecting the elimination of drugs from the body in elderly patients. How can changes in protein binding affect how drugs spread throughout the body in older adults? A. Increased protein binding leads to increased drug distribution. B. Decreased protein binding leads to increased drug distribution. C. Decreased protein binding leads to decreased drug distribution. D. No effect on drug distribution. The correct answer is C. Alterations in protein binding can affect drug distribution in elderly patients. Decreased protein binding may lead to decreased drug distribution. Why is monitoring drug concentrations crucial when dosing medications in elderly patients with altered pharmacokinetics? A. To reduce patient compliance. B. To adjust medication doses. C. To prevent drug-drug interactions. D. To increase healthcare costs. The correct answer is B. Monitoring drug concentrations is crucial in elderly patients with altered pharmacokinetics to ensure appropriate medication doses and reduce the risk of adverse effects or toxicity. What is a common consequence of age-related changes in drug metabolism in elderly patients? A. Increased drug clearance rates. B. Decreased drug clearance rates. C. Increased drug absorption rates. D. Decreased drug absorption rates. The correct answer is B. Age-related changes in drug metabolism can lead to decreased drug clearance rates, resulting in prolonged drug exposure in elderly patients. How can changes in body fat percentage in older patients affect how drugs spread through their bodies? Increased body fat decreases drug distribution. Increased body fat increases drug distribution. Decreased body fat decreases drug distribution. No effect on drug distribution. The correct answer is B. Changes in adipose tissue percentage can impact drug distribution. Increased adipose tissue leads to increased drug distribution in elderly patients. What is the typical effect of decreased liver function on drug metabolism in elderly patients? A. Increased clearance. B. Decreased metabolism. C. Enhanced absorption. D. Reduced distribution. The correct answer is B. Decreased liver function can lead to reduced drug metabolism in elderly patients, prolonging the presence of drugs in their bodies. How does the decreased glomerular filtration rate affect drug clearance in elderly patients? A. increases drug clearance. B. Decreases drug elimination. C. Enhances drug absorption. D. Reduces drug half-life. The correct answer is B. Decreased glomerular filtration rate in elderly patients usually leads to decreased drug clearance and a longer drug half-life. Which of the following pharmacokinetic parameters is typically increased in elderly patients? A. Drug metabolism. B. Drug absorption. C. Drug distribution. D. Drug half-life. The correct answer is D. Due to age-related changes in organ function, drug half-life is typically increased in elderly patients, affecting dosing regimens. How can changes in blood flow to different organs affect how drugs are distributed in older people? A. Decreased blood flow improves distribution. B. Increased blood flow reduces distribution. C. It changes how the body processes the drug. D. It has no effect on how the drug behaves in the body. The correct answer is A. Changes in blood flow to organs can affect the distribution of drugs in the body, impacting their concentration levels in different tissues. In elderly patients, how can reduced albumin levels affect drug distribution? A. Decreases protein binding. B. Increases drug clearance. C. Enhances drug absorption. D. Reduces drug metabolism. The correct answer is A. Reduced albumin levels in elderly patients can lead to decreased protein binding, affecting the distribution and availability of drugs in the body.